Hello and welcome. Today we're discussing a type of skin cancer that can affect the delicate structures around the eye, basal cell carcinoma of the pinna. While often associated with the skin of the face, it's crucial to understand how this condition can specifically impact the ear, or pinna, and subsequently potentially affect the eye and surrounding areas. We'll cover everything from causes and symptoms to diagnosis and treatment. So, what causes basal cell carcinoma or BCC of the pinna? The primary culprit is prolonged exposure to ultraviolet radiation, most commonly from sunlight. Think of it as cumulative sun damage building up over years. While genetic predisposition can play a role, sunlight exposure is the overwhelmingly dominant factor. Activities like spending a lot of time outdoors, particularly without adequate sun protection, significantly increase your risk. Tanning beds are also a major source of dangerous UV radiation and should be avoided. Let's break down the pathophysiology. When skin cells are exposed to UV radiation, it can damage their DNA. This damage can disrupt the normal growth and division processes, leading to uncontrolled cell growth. In the case of BCC, the basal cells, which are located in the lowest layer of the epidermis, begin to proliferate abnormally. Unlike other skin cancers, BCC rarely metastasizes or spreads to distant organs. However, it can be locally destructive, invading and damaging surrounding tissues if left untreated. Its proximity to the eye and vital structures around the ear makes this local destruction particularly concerning. Epidemiologically, basal cell carcinoma is the most common type of skin cancer worldwide. It affects millions of people each year. Those with fair skin, light hair, and blue eyes are at a higher risk. The incidence also increases with age, as the effects of sun exposure accumulate over time. Men are slightly more likely to develop BCC than women. Geographic location also matters, with higher rates observed in areas with intense sunlight, such as Australia and the southern United States. Recognizing the signs and symptoms is crucial for early detection. BCC of the pinna can manifest in various ways. Commonly, it appears as a small, pearly or waxy bump. It might be pink-red or skin-colored. Sometimes it can resemble a sore that bleeds easily and doesn't heal properly. Other presentations include a flat, scaly patch or a raised, reddish area. Because the ear is a sensitive area and close to the eye, even a small growth should be examined by a medical professional. Pain is not usually an early symptom, but it can develop as the tumor grows and invades surrounding tissues. Diagnosis usually begins with a thorough physical examination by a dermatologist or a physician experienced in skin cancer detection. If a suspicious lesion is identified, a biopsy is performed. This involves removing a small sample of tissue for microscopic examination by a pathologist. The pathologist can then determine if the lesion is cancerous and, if so, what type of skin cancer it is. The biopsy is the gold standard for confirming a diagnosis of basal cell carcinoma. Imaging techniques, such as CT scans or MRI, may be used in more advanced cases to assess the extent of the tumor and determine if it has spread to nearby tissues or lymph nodes. While there aren't distinct classifications or types of BCC specifically related to the pinna, BCC itself has different histological subtypes. Nodular BCC is the most common, appearing as a raised, pearly bump. Superficial BCC presents as a scaly patch. Morphiform BCC, while less common, can be more aggressive and difficult to treat. Pigmented BCC contains melanin and can resemble a mole. The specific subtype doesn't dramatically change the treatment approach for pinna BCC, but it can influence the surgeon's strategy and the monitoring plan afterwards. Treatment for basal cell carcinoma of the pinna depends on several factors, including the size, location, and subtype of the tumor, as well as the patient's overall health. Surgical excision, where the tumor and a margin of surrounding healthy tissue are removed, is often the first-line treatment. Mohs surgery, a specialized technique that involves removing thin layers of tissue and examining them under a microscope until no cancer cells are found, is particularly useful for BCCs in cosmetically sensitive areas like the ear. Other treatment options include radiation therapy, which uses high-energy rays to kill cancer cells, topical creams such as imiquimod or 5-fluorouracil for superficial lesions, and photodynamic therapy, which involves applying a light-sensitizing drug and then exposing the area to a specific wavelength of light. In advanced cases, targeted therapies or immunotherapy may be considered. Prevention is key when it comes to basal cell carcinoma. The most important step is to protect yourself from excessive sun exposure. Wear protective clothing, such as wide-brimmed hats and long sleeves, when outdoors. Apply a broad-spectrum sunscreen with an SPF 30 or higher to all exposed skin, even on cloudy days. Reapply sunscreen every 2 hours or more frequently if swimming or sweating. Avoid tanning beds, as they significantly increase your risk of skin cancer. Regularly examine your skin for any new or changing moles or lesions, and see a dermatologist for annual skin exams, especially if you have a family history of skin cancer or a large number of moles. The prognosis for basal cell carcinoma of the pinna is generally excellent, especially when detected and treated early. Because BCC rarely metastasizes, most cases are cured with appropriate treatment. However, there is a risk of recurrence, particularly if the tumor was large, aggressive, or incompletely removed. Regular follow-up appointments with a dermatologist are essential to monitor for any signs of recurrence. Recent research is focusing on developing new targeted therapies and immunotherapies for advanced BCC. Additionally, studies are investigating the genetic factors that contribute to BCC development, which may lead to new prevention strategies in the future. Continued advancements in diagnostic techniques, such as non-invasive imaging, are also improving our ability to detect BCC earlier and more accurately.